late. I do apologize for that, but we've gotten everybody here. I just saw Mrs. Grimm has joined us, so that brings us to our full complement of 8 as we stand right now for this meeting. And I see we're now being recorded, so thank you for that, Mrs. Bickert. So we're going to get started with this special meeting of the Pottsgrove School Board. Tonight has a very limited agenda for the things that we're going to be discussing, and we'll get started on that. So, Ms. Bickert, normally you'll bring up my cue cards to show me what we're going to talk about, and normally we get started with the Pledge of Allegiance. So you've got a flag there, Ms. Custer, so we'll get started with that. Pledge allegiance to the flag
of the United States of America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Again, thank you all and welcome. Secretary will please note the roll, and as I mentioned, we have everybody here, 8 of us who are supposed to be. We'll move on to our executive session announcements. Pottsgrove School Board held executive sessions virtually on July the 20th, the 21st, the 28th, and I should add, most recently on August the 4th, just prior to this meeting, to discuss safety. And now we're going to get into public comment. Tonight's public comment is going to be different than what we've done in the past. We had mentioned that we wanted to go with meetings face-to-face. That, of course, has not worked out. But tonight what we are going to do is our Secretary, Ashley Custer, is going to be having, as we mentioned, you might have been listening just before the meeting started, we are going to use the raised hand. We are going to have open mics, so people are going to be allowed to be making public comment. We do have a time limit on the comments of 3 minutes for the comments that you can make. In the background, the Q&A function, you can continue to type your questions if you want to ask questions of the administration. The administration staff who's been handling the questions in the previous town halls and some of the previous board meetings will be continuing to be on hand. Dr. Shirk has had his staff here to help with those. For people who'd like to ask questions, they'll be continuing to try and help us with that. But for people that want to make comments as we consider our health and safety plan and what we're doing going forward, tonight is your opportunity to literally make your voices heard with an open mic. So our board secretary, Mrs. Custer, is going to handle that for us. And so she's going to also be keeping the time. So as we get close, as we get about 15 seconds left in the 3 minutes, she'll be advising you of that and then winding your comments down if you get to that point. She'll be, so you hit the raise hand, she'll let you know, she'll say, I'm going to call on such and such a person, and they should take your name. And I think Mr. Davis, so he'll clarify, we also have to have your address as well, if I'm not mistaken, for the record. If you'll please set me straight there. So the time will start once you've given your name and your record, and then we'll start the timer, and then you can go. So if any part of that is not clear, not correct, just set me straight, and then we'll start with our first person. And Ashley, you have it from here.
All right. Okay, our first raised hand is Marilyn Eaton. I just unmuted you, Marilyn, and if you can just state your address.
Actually,
and from there on, you have.
I was just trying to help you guys out when you guys were started. I don't have.
Oh, gotcha. You're just trying to raise your hand for me. Gotcha. All right, then never mind, but thank you. All right, so next is Kelly, apologize if I mess up your name, Riegard. You are officially unmuted. If you can give us your address and then your comment.
Can you hear me?
Yes.
Okay. I am at 1411 Meadowview Drive.
You can go ahead.
Okay. I had concerns about the ventilation that's in place in the school, in the classrooms. And the last meeting you said it was going to be a M8, MERV 8. And I was wondering if there was any objection to parents being able to bring in a non-ozone medical grade air sanitizer into the classroom.
Okay, Kelly, right now this is going to be comment only. So I'd say if you have a question that you want to have answered, put it in the Q&A, and then the administration can take a look at that, and they can either answer it tonight, or they can, sort of tell you that they're going to look into it and get back to you. Okay.
Okay, no problem. All right.
All right.
Well, then can I comment?
Absolutely.
I
Go right ahead.
I appreciate everything that everybody has done. This has been just an emotional roller coaster for everyone, every parent, everywhere. There's just so many options and so many things that we as parents also have to consider, and especially the younger kids. I have a 7-year-old who, struggles with online, but, under due circumstances, we understand that that's our options, and we're going to be able to go with it. So I do want to let the board know that we all appreciate the time and effort that you've actually put in.
Okay, thank you very much, Kelly. It's we all appreciate that.
You're welcome.
Okay, so our next raised hand is Rick Rabinowitz. So I'm unmuting you right now, Rick. And if you can start with your address.
Can you hear me?
Yep.
My address is 5 Lee Drive in Pottsgrove. And I think I'll be brief here. Only 3 minutes. I'll try to beat it. First of all, I'm glad it's you folks and not me. I'm going to make this decision because it's not an easy one. And personally, it's an easy one for me because I only have one kid left in the school, and he's a 10th grader, and he wants to do online, and I want him to do online. So I have no agenda because it's going to work fine for me. But what I wanted to pass on to you folks is that I have heard from more than a few teachers, I guess because I run the Facebook groups, who are really scared about having to work in the building. And I know that that there have been surveys taken, and I don't know the results of those, and I'm not asking what they are. But I personally have thought about this every which way, and I'm just scared that that opening the buildings will result in people getting the virus, no matter what you do. So I know you're scared about that too. I'm not telling you anything you don't know, except to say that some very intelligent people I know are not convinced that 6 feet without masks will protect our teachers or our students. And that's the current plan, as I understand it. And I feel for the parents of younger kids who aren't well suited to online, and understand that it's a different calculus for them than it is for me personally. But I'm thinking about the health of the parents. Then the last thing I will say is I know that some people believe that children don't transmit the virus and can point to. I've seen some posts, but just yesterday there were 2 studies that were released that pretty much refute the notion that younger children don't pass on the virus. In fact, one study suggested that children under 10 have more virus than older children. So that's all I got. Good luck, everybody. I know it's tough.
Okay, the idea was this is, I'm just going to just step in and say one thing, and Dr. Shirk, please correct me if I'm wrong. I just wanted to clarify one point. The plan is that we have 6-foot spacing and masks. That is in accordance with the governor's guidance that everybody outside of their homes is wearing masks. So that is in our safety plan. That was a revision. I think we're on revision 8 or 9 now, and that was a revision back around revision 6. So as I said, please clarify, please correct me if I'm wrong, but we are going to have masks in school. That's something that we have had for 2-3 weeks now, or since the governor put that out a while ago.
That is correct, Mr. Lindgren.
Wait a minute. I thought in an email today, there was something about the fact that if the students are seated 6 feet apart, they would not be required to wear masks.
Dr. Shirk, if I may, it's contingent. So it says 6 feet, and that's per the governor's orders, and also per the governor's orders and additional guidance that we've had from a variety of health agencies. It says not only 6 feet apart, but also additional criteria. So they could either be seated they have to be 6 feet apart, seated at their desks, or eating and drinking, or involved in some sort of physical activity. So you have to have 6 feet apart and one of those additional factors in order for them to be able to remove their mask. At any time, if they're under 6 feet, the mask is put back on.
Okay, well, I don't see any more hands raised. So, Bob, you were correct. So
Go
if
figure.
anybody else is gonna raise their hand, go ahead and do it now. Oh, there's one. All right, so next we have Carrie Palmer. And Carrie, I'm gonna unmute you, and if you can give your address, then you have 3 minutes.
Hi, everybody. I'm Carrie Palmer. I live at 2103 Prout Farm Road. We've been in the district for a really long time, and I actually have 4 students who are in the district right now. So I have a kiddo who's going into kindergarten. I have a kiddo at the middle school. I have a kiddo at lower, and I also have a kiddo who's at the Western Center and a senior this year. So I have a lot of students in the district, and I'm also a teacher at Boyertown Area School District. So I understand the quandary that you're in with making this decision, but I do just want to express my concern. You know, my kids really do want to be in school, but I, as a parent, just want them to be as safe as possible. And I really feel that virtual learning, even though it wouldn't be the best for all of my kids, it wouldn't. I just feel that that would be the safest option. And Pottsgrove teachers are amazing. They're awesome at doing what they do. And I feel like as a teacher, they can do amazing things online and really plan for some instruction that's valuable to students and relevant to students and engaging. So I think that if we have the option to keep our students safe, to keep the staff safe through virtual learning, and we can still offer quality education, that we should choose that option instead of taking, really, I feel like it's an unnecessary risk of putting kids back in school and teachers back in school and just hoping for the best and saying maybe this will work out. But thank you all so much for everything that you've done. And I really, honestly, I don't envy your position at all. But I just wanted to chime in.
All right, thank you very much, Carrie. All right, next is Lisa Futchko. Lisa, I'm going to go ahead and unmute you if you can just give your address. Thank you. Oh, there we go. Maybe.
Can you hear me?
There we go. Yes. Okay.
Hi, I'm Lisa Futchko. I live at 18 Creekside Drive in Pottstown. First off, you guys, again, like everyone has said, I don't envy you one bit. This is probably the most tumultuous time I think we've ever had in our lives. And the last 6 months have been absolutely challenging. I work as a human resources manager, and I've created more policies, procedures that have changed, not changed, and all that. It is impossible to keep up with everything going on. So I absolutely appreciate all of the work that you guys have put in to try to keep our students, families, and teachers and everyone safe. There is no right answer to anything that any of us do. There is none. There is no good answer to this problem that we have. My concern is honestly for working families, and this whole thing, I mean, the whole situation just stinks, because clearly putting our kids back at school to help our families does put teachers, janitors, custodians, paraprofessionals, everyone and students at risk. To me, and again, this is my impression, is that we are heavily leaning, towards virtual learning. My littlest is horrible at it, but we'll make do. Again, my concern is, I hope that there is going to be some consideration or some help for our working families. I can't work at home, so my littlest is going to be going to a daycare center to help with learning, which is going to be an expense that I don't count on, of probably $800 to $1,000 a month. You have more than one kid who's an elementary child. Imagine that cost that this is going to incur on our working families. I'm not saying anything anybody doesn't know, anybody hasn't thought of. I just hope that there is going to be some consideration or some thought put into helping our working families. And, whatever the answer is, we'll all get through it, as long as we all get through it together. And I hope we can all get on the same page and get a workable plan going forward. Again, I thank you guys so much for all the work, all the time, the effort that you have put into this. It is heartless, I know. And I mean, heartless wasn't the right word, sorry. It's gut-wrenching. It's awful. And I do appreciate everything that you put in. So thank you guys, and looking forward to next part of the meeting.
Thank you, Lisa. Right, next is Stacy Messing. Stacy, I'm going to go ahead and unmute you, and if you can just give your address. Thank you. Oops. I'm going to try to unmute you. Wait.
How's that? Can you hear me now?
Yep.
Okay, 1979 Summit Way. I wanted to jump on and give my opposing view to not considering having some sort of on live schooling. I'm a healthcare worker, and I had to be in the hospitals in very close proximity with known positive COVID patients. And it was very scary in the beginning. I've never been in that situation. I've never knowingly put myself in harm's way. Yes, I had extensive PPE, which won't be available in the schools, but we do have protections in place in the school that are appropriate for 6 feet of distancing with appropriate circulation, and for not known positive cases. So let's say assumed negative cases. So there was something on Facebook that was really powerful, and sort of summarized how I felt going into a new situation that was extremely scary and uncharted. So I'm not going to read the whole thing, but I do want to read a couple of paragraphs because it says it better than I could ever say it. Anticipation, and this is about, it's from healthcare workers to teachers, because everybody that has a kid, well, I shouldn't say everybody, but those of us that many of us are very empathetic to what the teachers are going through. I work in a school. I happen to know behind the scenes what the teachers go through, and it is extraordinary what they've been doing. And nobody takes this decision lightly to ask the teachers to go into the situation. So I just want to read this real quickly. Anticipation of a new situation can often be a lot scarier than the actual experience. In the early days of this pandemic, I'd sit at home on the weekend and absorb the terrifying news. I'd wake up Monday full of anxiety. Then I'd go to work and realize I have autonomy. Not everything is out of my control. There were a lot of steps we could take to protect ourselves, and so we did. We didn't sign up to put our health and the lives on the line for our jobs, but we are essential workers. Without our work, there are populations at risk. Whether it's a patient without care or a student without a promise of a good education, we are needed. They needed us to show up, so we did. There will be coworkers that you have that struggle, that need your compassion, your ear, your encouragement, and you will also have moments like this. We need each other to validate our experiences, and so we did. As the days go by, you will adjust to the masks, to the cleaning routine, to the running dialogue of fears. You will get quieter, and your confidence to handle these insane times will grow. We need to carry on, so we did. You will be proud of yourselves. You will feel more like a team than ever. You will love those students harder than before, and you will look at your time at home with your family with more appreciation. You are teachers. You've had a career full of challenges. Change is an uphill battle. You will conquer this strange and unfamiliar challenge too. Your students, their parents, and your coworkers know you can, and so you will. We wish you all the best at the start of this school year. I promise as a parent to support you. We will do this. I believe that, and I felt so proud. I felt so emotional when I read that, because I've heard so many people say, you know, oh, I'm going to have to do all of these new things in school. It's going to be all about telling the kids not to do this, and sanitizing, and keeping the distance, and all it comes down to is a new routine that we have to follow, and new precautions that we have to follow. And it's not impossible, and it's not an unnecessary risk. It's a calculated risk. It's not even a calculated risk. It's a protective. I don't have the right words anymore. I lost my train of thought, but I just wanted to read that, and I hope that conveys a lot of what I couldn't put into words.
Thank you very much, Stacy. All right, appears that's it. So there's anybody else? Raise your hand now, or we're gonna move on.
Okay. Very good. Well, 15, I was off by 9 minutes. So we'll move on to section 4.1.
Thank you, Mr. Lingren.
Wait a second. Now I'm getting a message that there's more, but I'm not seeing more. Question, no, this is, I don't see any more hands raised. Okay, never mind. Okay, I think we're good. My apologies.
Okay, thank you, Mrs. Custard. Moving on to 4.1, the iPad lease. The recommendation from the administration is to authorize to enter into a lease agreement with Apple for 825 iPads as presented.
So moved.
Second.
We have a motion and a second. Does anybody have any questions on this?
Just one question. When would they arrive? I'm not sure if I'm reading it and just missing it.
Mr. Bickert, I'm going to ask if you would jump in there, or Mr. Nestor, regarding the anticipated arrival. And then how about just taking it one step further as far as the implementation piece as well?
Yeah, I'll jump in. I believe the anticipated arrival is somewhere around the end of August, with approximately 2 weeks of configuration to take place. And we're going to do the best we can to get it done as quickly as possible once they do arrive.
So with that being said, Mr. Bickert, we do have, currently we have the older units available for use, and then they will be swapped out, or do you think we have a shot by August 31st of getting some of them out for either third grade, fourth grade, or fifth grade, or a combination?
I think we will definitely have K2 devices ready to roll out. And as the new devices come in, certainly we can get them out as soon as they're configured. We obviously don't need to wait until they're all configured to start sending them out. We can stage them.
Thank you.
Okay, are there any other questions? If not, all those in favor signify by saying aye.
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 All those opposed say no. So ordered without objection.
Okay, moving on to action. Excuse me. Moving on to action items for policy 5.1. We're putting forth a resolution declaring an emergency pursuant of section 520.1, the PA School Code. We're asking the board to approve this resolution declaring an emergency pursuant of the 520.1 in the Pennsylvania School Code as submitted. Before I ask for that motion, I'd like Mr. Davis to basically just inform the board and the public what this means for the district.
Yes, Dr. Short, pleased to do so. By way of a little bit of history, recent history, last year, the state legislature gave the school districts relief on the minimum school time, which is, I can be corrected by the administration, the experts, but it's 180 days of instruction or 990 hours. And this year, the legislature has not done that. So if you're not going to school full time, you have to declare emergency and have a plan approved by the Commonwealth of Pennsylvania, the Department of Education. I'm not sure there's a magical order to how we do the next three items, but in talking to Dr. Shirk, my logic was that before you could do 5.2, it made sense to do 5.1 in that we declare a resolution, because if we adopt 5.3 or some other form of instruction tonight, we're going to have to submit that to the Commonwealth for approval. So this is more procedural. I don't want to make light of it, but at this point, it's more form over substance. You may or may not be aware, other districts that are doing different kinds of delivery of programs are adopting a similar resolution, so we can ask for relief if we need it. Of course, this doesn't commit you to any program. It doesn't commit you for any period of time. All it does is give you the ability to submit an amended plan, not an amended, a plan to the Commonwealth that has something less than full-time instruction. I'm pleased to answer any questions, but again, this is more a procedural item than substantive.
I have a question probably for Lori. Is this resolution able to be read by the public? If not, I wonder if we should read it so everybody hears it.
It's in board docs, so anybody who wants to read it can go to board docs.
Thank you.
So at this time, I would like to recommend the resolution declaring an emergency pursuant of section 520.1 in the Pennsylvania School Code as submitted.
So moved.
Second.
We have a motion from Mr. Leach and a second from Dr. Nipper. Does anybody have any questions on the resolution? Hearing no questions, all those in favor signify by saying aye.
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 All those opposed say no. Very good. All right, so ordered without objection.
Okay, moving on to 5.2, school health and safety plan. A week or so ago, we had a town hall, extensive town hall with over 700 participants that we went over this particular plan in the town hall in a formal, informal fashion, if you will. Tonight, I just wanted to go over it again, a little bit of a briefer form, but with the same content and validity involved with it for anybody who might be new tonight. So we're gonna switch screens, and myself and some of the directors from the Pottsgrove School District are going to go over some of the highlights and specifics of this plan before we move on to any motion. Okay, I just wanted to thank you. I just wanted to shrink my screen a little bit there. And obviously, this is the phased school reopening health and safety plan for the Pottsgrove School District. And as we move to the next slide, I just wanted to basically let our public know that this is a requirement by the Pennsylvania Department of Education. And during this process, we had to incorporate a lot of flexibility. As Mr. Lindgren alluded to, this is about our 8th time that we've made changes along the way over the last month. We've had to adapt to that change. We started talking about this process back in May. We received the template in June. We've been analyzing the data that is given to us at numerous healthcare agencies at the federal level, at the state level, and obviously at the local level. And we've been working, with our teams of teachers, our directors, our building principals, and obviously district office administration over this time period to develop this process. We even took a step back a couple weeks ago, and with our partnership with our union, we gave them an opportunity to weigh in and answer their questions. We're still going through some of those questions, and we'll answer more of those questions as we move forward, as we talk about the different plans and opportunities that we have for our families and our students. The next slide will really just show the different organizations that we used in our phased-in plan. It lets you know that I think it's an extensive group with a lot of expertise that helped us formulate a plan that was going to work and be in best interest for our kids in our community. One of the things that was brought up even tonight, and I'm gonna pass the microphone to Jeff Cardwell, was the cleaning, sanitizing, disinfecting, and ventilation pieces. And Mr. Cardwell is just going to update the community on those particular items. Mr. Cardwell.
Good evening. The Facilities Department has been following the guidelines and recommendations of the CDC, the EPA, ASTRA, and the AIHA. Through these guidelines, we have developed standards for our evening shift for sanitizing all locations, which consists of cleaning and disinfecting the entire buildings, following the EPA guidelines. Our day shift staff will focus primarily on disinfecting high touch points in restrooms throughout the day. That is our process for our frequent cleaning. Ventilation updates. Someone had mentioned about our MERV filters. It is recommended by ASTRA, if possible, to increase your MERV rating from 8 to 13 and change the filters frequently and introduce as much fresh air as possible to the buildings. 24-hour room closure will take place as if there is a situation where a COVID-19 person has exposed a room within the building. That room will be closed for 24 hours and then thoroughly disinfected to put back into service. Bus cleaning after each run. As I stated, we will clean each bus after each run and then disinfect it as well in the evening. Those are the processes that the Facilities Department is taking forth. And addition, we have purchased additional cleaning and sanitizing equipment, electrostatic sprayers, handheld foggers, electric sprayers to help increase our time for disinfecting the building, and introducing even more microfiber hand washing stations in the building for our staff to wipe down touch points throughout the day.
Thank you, Mr. Carwell. Anything else you wanted to add? Just, with the opportunity, I just wanted to, anything you wanted to share with the community other than the pieces on the PowerPoint? Just, I know your group has done a lot of work in the last months, not just weeks. So I just wanted to give you maybe an opportunity to maybe give some of that particular insight.
Yes, sir. Pottsgrove is one of the school districts that did not close down our buildings throughout the COVID-19 time frame when other schools closed. The facilities department stayed operating. We continued to ventilate our buildings during this entire time from that March 6th time frame. We continue to disinfect the buildings on a daily basis. We have introduced more of disinfectant product that meets the EPA regulation that's hospital grade. So we have stocked up on disinfectant products, hand sanitizing products, and as I said, the equipment. So we maintained our buildings to safe standards by, as I spoke about, the CDC and the EPA and ASTRA and the AIHA during this whole tenure of school being closed. With the intent, if school was to be open, there wouldn't be a stress for us trying to get buildings back up to a capacity that make it safe for staff.
Thank you, Jeff. I appreciate that added piece. At this time, we're going to move to our next slide. And Mr. Daniel Voris, he's going to talk about our social distancing and some other safety protocols that we have in place.
Good evening. The social distancing and other safety protocols part of the plan really talks specifically about how we're handling social distancing within our school and all the things that we need to consider as we do that. As previously mentioned, we are working with 6-foot standard that comes directly. There's some differing points of view on that, specifically from health advisories. However, within Montgomery County and our Department of Health, they suggest sticking with the 6 feet, and therefore we are working toward that as well. So there are a number of things that need to happen in order to make sure that we do maintain that 6 feet of social distancing. That includes something the facilities department is already engaged in, specifically working with building principals, walking through classrooms and arranging those classrooms to make that happen. Teachers are pulling out any of unnecessary items, specifically furniture that might not be needed, so that we can maximize all of the instructional space that we have within our buildings. As we also indicated earlier, we're working with face coverings. So anytime in any building or on a bus, you're within 6 feet of someone, you are wearing a face covering. There is face covering. That term really covers masks, shields, additional pieces, and that's all outlined specifically within the governor's order. We spoke about if students are seated 6 feet apart and they're seated at their desk, or they're eating and drinking, or they're involved in physical activity, then they may take off their face covering at that particular point in time. And there also are provisions that exist for some students, in particular any student with disabilities, some mental health, or inability to independently attach or remove a face covering are some of those provisions. To the greatest extent feasible, and that's guidance that we've received again from multiple organizations, we're limiting the movement of students at the elementary level. That's an easier task than it is at the secondary level. That's because our elementary generally live in classrooms and they live in cohorts, whereas at the secondary level, because of very specific content, course content, and or teacher certifications, that's not as easily done. However, we are working within those secondary buildings to minimize, to the greatest extent possible, any movement of students that might be occurring. There have been some questions specifically about lunch. Our lunch will offer limited offerings and selections. Those will be prepackaged. Our elementary schools will be eating lunch in classrooms. At the secondary level, we'll be using alternative spaces, the cafeteria, auxiliary gyms, and all the tables and desks will be cleaned both before and after the serving of lunch. There will be ongoing communication specifically for students and staff. There's a training aspect of this, so just those ongoing reminders about the importance of cleaning, the importance of respiratory etiquette, appropriate ways to sneeze, for example, hand hygiene, face coverings. Those constant reminders are really necessary. And as we talk about hand hygiene specifically, I know the facilities department is already working with principals. They're examining classroom spaces and they're determining the best placement for those sanitizing stations to offset any places that really don't have a sink for hand washing. And the other piece to this particular part of the plan is really just what we term and what the state terms non-essential visitors. That's really limiting the use of our buildings to staff and students only. Parents will not be allowed past the school office, and we'll be working with setting up any virtual meetings by parent request. Of course, if they have a need to talk to the teacher, we can set that up and plan for that virtually.
Thank you, Mr. Boris, for that. We'd like to move now on to monitoring student and staff health. Dr. Presido, or is she going to take it, Daniel, or are you going to take it? I'm not sure. Is she in a position? I know.
Yeah, Daniel, can you take it? Kate just mentioned that she, being without power, she was in her car trying to get connected and lost connection.
Yep, absolutely. Kate and I, Dr. Presido and I already talked. Kate is still weathering the effects of Isaias. So however, she is with us, just unable to use a whole lot of bandwidth.
Thank you.
So these are slides that she's been working on specifically, and some of the work that's included within here. So specific to this slide, we're really working on symptom screening. So what that means is this will be done by both our parents and staff each day prior to school. That will be guidance that we're utilizing from CDC as well as the Montgomery County Department of Health about how to complete that symptom screening. And again, that will be provided by PGSD using those areas of guidance. That will be done daily by both students and staff, or parents and staff. We are working with, it's kind of numbers fly around in my head. I think about a 6-15-48 rule. So it's really, this is a contact tracing piece in the event that there would be any confirmed cases or suspected cases. Any individual that was within 6 feet of an individual that has tested positive for 15 minutes over the previous 48 hours, we need to report that information directly to the Montgomery County Department of Health, and really through a partnership with the Department of Health. And that partnership will really be critical for continued contact tracing, examining potential exposure, ongoing guidance, any new established protocols that they might have in that particular area. We are also working on a bi-weekly questionnaire, and the purpose of that is really to monitor changes within our families and our students, anything in terms of changes that may have occurred that may have a result in a potential exposure. Perhaps they've traveled to an area where there's higher numbers of COVID-19. Perhaps it's on one of the travel restriction areas. So we're working on that questionnaire just to keep that information. Again, that really helps with our partnership with the Montgomery County Department of Health. During this time, we also recognize there's some significant social and emotional needs, and I think I can safely say for everyone that we've all had some social and emotional needs that need to be met, and we're really cognizant of that here in Pottsgrove, and working toward the ways in which we're really going to support that process for our students. Thank you, Dr. Ramage, for moving on to the slide there. We have been provided ongoing guidance following the quarantine. So anybody who goes into quarantine, we're really following guidance that exists for us in terms of how do we handle that particular piece. In the event anybody's coming back from quarantine, whether it be a student and or staff, parents or the staff must notify the district that they are returning from quarantine. And we have continuous monitoring of any mental health effects that may be associated with COVID-19. I know Dr. Presido is working directly with teachers, counselors, social workers in order to connect with families. Dr. Presido and I will be teaming up to really develop and further develop, I should say, our back to school transition. So in the event any child is on quarantine for any period of time, but still able to participate in their schooling, we want to make sure that that seamless transition can occur back into the school setting if and when they are able to do that. So we are working on a back to school transition period that will help ease any interruptions that may occur with the child's schooling. The other piece I know there have been some questions on is just specifically about when to come back after a quarantine. So I'm just going to read Dr. Shirk for just to be clear, exactly what we have written in our plan. So let me just see here. If a student or staff has symptoms and it is possible the individual has COVID-19, the individual will be sent home. We go further later on in our plan and say individuals who are sick or have a temperature must go home or directly to a healthcare facility. However, prior to leaving school, the school must provide guidance on self-isolation, and that guidance will be coming directly from CDC in terms of the guidelines that they have provided for us. If in fact we have an individual who tests positive for COVID-19, whether that be staff or students, they may return to work only after, and there's sort of 3 criteria here that I ask everybody to listen to, because some individuals were thinking it was only after 3 days. That's not the case. So in the event somebody has tested positive, they may return only after 3 days without a fever, and that's no fever reducing medication associated with that. Their symptoms have improved, and it's been 10 days since symptoms first appeared. Kind of running parallel to that, if somebody's in the process of quarantine or they know they've been in direct contact with somebody who has tested positive, the employee and or student will stay home for 14 days following that exposure. So I know there have been some definite questions about those pieces, so I just wanted to read those directly from our plan, hopefully to clear up any of those particular pieces. Thank you, Dr. Ramage. We've already talked about number 7 on this slide. We've talked about face coverings, I think, multiple times, and the protocols that are in place. This specific part of our health and safety plan really identifies what are our protocols for dealing with anybody who might be at higher risk. How do we deploy staff in order to best meet those particular pieces? I do know that Dr. Presido and Dr. Cantor are working specifically with CPI teams, really to emphasize de-escalation techniques. And I know they're working through the process of additional PPE that might be necessary in any classroom for students with complex needs. And that could include cover-ups, face shields, arm guards, aprons, and any number of things. And I know they're walking through that very carefully. I know also that Dr. Presido and Dr. Cantor recently held a parent town hall, and that was for special education. I know the questions and answers for that, as well as the recording of that town hall, have been posted on our website, so that anybody that might have questions, if you're a parent of a student with an IEP, a GIEP, a 504, many of those questions have already been answered in that particular format.
Thank you, Mr. Boris. Appreciate that. And Dr. Presido, obviously, I know you're listening in. I appreciate you helping put this, all these things together. At this time, I just really, want to go back and really thank the community for all your support over the last, it's going on almost 6 months. And the things that we've worked hard with during this process, as we entered into COVID and worked our way into the summer, and here we are tonight, is we always kept in the forefront that students' safety and health, behavior and academic needs were a top priority as we worked our way through this. We also found out, based on what we learned from last spring, was we needed consistent schedules to help students reach their goals. We also know that live streaming keeps students connected with their teachers and with each other, and that is important. And of course, these connections are what really builds student success. So as we looked at formulating our programs, both virtually and hybrid, these were 4 pillars that we continue to go back and to revisit. As we have posted and as we have shared with our community, there are 2 educational options on the table as we sit here and speak to you tonight. There's a hybrid program and the Pottsgrove School District Virtual Academy. I think the highlights of these 2 pieces are they will be taught by our Pottsgrove School District staff. The hybrid program obviously is a 50-50 model where 2 groups will be, the district will be divided in 2 groups, and we'll have an online for 3 days a week, and we'll have in person 2 days a week. Our goal, we will have synchronous and asynchronous learning during this time period when our students at our home. And as you see the bottom, the last bullet under the high program, Monday, Tuesday, or Thursday, Friday on site. Wednesday will be office hours with asynchronous learning check-ins. And then of course, Thursday, Friday will be a synchronous time where students will be in the virtual world while the other half of the class is in person. The Virtual Academy, featuring fully online sessions, both live and recorded, will be scheduled for the 100% of the school day. We'll follow a building schedule like they would in a tongue-in-cheek, a normal school year. And of course, the learning will be synchronous and asynchronous. The hybrid model, as we present it, will be on a 6-day cycle, just like our students would be on. This will help us rotate in all of our core subjects as well as our on-core subjects. This will have on-site and remote learning. Some of this I've already said to you, but I think the bullet points are worth mentioning. The live synchronous learning to the greatest extent possible, Monday, Tuesday, Thursday, and Friday for elementary. Live synchronous learning Monday, Tuesday, Thursday, Friday in the secondary. We continue to work with our elementary, our K-5 division, as we learn our new learning management platform in Schoology. And those pieces again will be, the face-to-face pieces will be our greatest learning tool, but we will do the synchronous part really to the greatest extent possible as we continue to work through those pieces. Wednesdays, again, will be office hours. Our buildings will follow daily schedules. Obviously, like any school year, tutoring will be available. We look to honor all of our courses, honors, AP, and our dual enrollment. And of course, daily attendance is very, very important, as it would be in a regular school year. Specifically, our virtual academy, as I've mentioned before, it's our Pottsgrove School District staff. It's our Pottsgrove School District curriculum. It is entirely online, identical instruction, content and pacing. We're looking for synchronous learning 4 days a week. I've already talked about the asynchronous components of Wednesday. We're going to continue to follow a schedule, obviously, and honor the courses that we have to offer our students, which are AP, honors, and dual enrollment. And obviously, attendance will be taken in this educational venue as well. Our next steps and what we have done over the last several weeks is compile parent intent data. And I just want to break to that. I had a chance to share that information with the board and I just want to share it with the community. We'll be able to get this up posted as soon as we can. We had 2,232 children check in, if you will. Their parents checked them in. It's probably about 1,000 short. It's 66% of our school district weighing in on this. And at this point in time, if you look at it by division, the K2 division is looking at a hybrid band of 54%, and a virtual academy, obviously opposite of 46. And the 3-5 band is looking at 57% of hybrid and 43% for the virtual. The middle school, the 6 through 8, is looking at 45% hybrid and 55% virtual. And our high school division, 9 through 12, is looking at 59% in the hybrid model and 41% in the virtual model. Overall, it's 54% grade band total for the hybrid model. So I wanted to share that information with the public and the board. I know they had an opportunity to make it, but I think it's important that we weigh all those pieces as we look at our statistical data moving forward. Another component of our next steps is assessing all of our staffing considerations. And in these COVID times, we have to take every consideration possible with every one of our staff members, our teaching staff, our support staff along the way. So that continues to play an important factor in offering these two options to our community. Some of our next steps also is to prepare the classroom, and we are putting together pieces to show what a classroom would look like at all different levels, K2, 3, 5, middle school, and high school. We're in the process of finishing up our rosters and schedules. I know at the high school, Dr. Ziegler was working on getting this information out sooner than later to our families as we continue to communicate as frequently as possible and give people an opportunity to weigh in. We continue to plan collaboratively for both the hybrid piece and the virtual piece as we move this forward. So as I wrap up our portion tonight and we turn it back over to the board, I just wanted to thank our community for their input, and I also want to let you know that the tasks that we've had and have been before us, it hasn't been easy. And some of the people that have spoke tonight during this chat time, really, it has been a tumultuous time, and it has been very difficult. And there's been a lot of long hours and long days. But I can tell the community, the Pottsgrove community, that the district office administration, our building level administration, have put tireless effort into our plans, our virtual plans, our hybrid plans. None of it will be perfect. Obviously, there is a risk involved in anything that we do, but we do feel that we've done our due diligence with this plan. We've followed healthcare guidelines that are current and up to date, and that piece, if that's the chosen piece, will allow us to open up school. The virtual piece as well. I think it's important to note that we came out of last year and we learned a lot of different pieces of what we had to do to make it better. We knew we had to have more synchronous learning. We needed more face time in front of our students, and we have worked. Our teachers have worked and have started to work over the last 2 weeks, and will continue to work up until the start of school in really perfecting the trade of online learning, online education, and preparing lessons that will be able to be seamless as we move forward. So I thank you for listening to us, and at this time we're going to move back to the agenda. And at this time, we're asking the board to approve the phased reopening of school health and safety plan as submitted. Now, So as submitted, it's submitted in the hybrid model with a virtual component.
So moved.
Second.
All right, we have a motion and a second. Does anybody have any questions they would like to ask?
I have
Or-
some questions.
Sure, Mr. Parker.
All right. So where are we at with the thermal cameras? And if they're not guaranteed to be in place in time, what is the plan in regards to checking temperatures prior to students entering the building until the thermal imaging system is in place?
Well, regarding thermal camera, I want to ask Mr. Nestor to weigh in, and then we'll circle back to the next pieces.
Thank you, Dr. Shirk. The thermal cameras have been ordered earlier this last week, excuse me, and we paid an additional fee for 2-week turnaround on our shipment. So we should have them hopefully by the 15th of the month, which would give us approximately 2 weeks to have them installed and operational, which seems to fit into Mr. Cardwell's timeline to accomplish this.
If I could add something, Mr. Nestor and Dr. Shirk, right before the board meeting start, the sales rep from Health Guard contacted me. The product shipped today, so we should see them any day now for the thermal cameras.
Thank you. And in line with that, how about PPE supplies and sanitation supplies? Do we have a guaranteed arrival and placement to occur before school starts? And if not, what is the plan, until they are here and in place?
I just stopped in the office this evening to check the receipt, and we do have quite a bit of the PPE that has been ordered. Certainly not all of it. We are monitoring it, and if it comes down to the point where we lose confidence in our vendors to be able to provide, we will seek alternate resources for those PPE. But so far, things have been coming in fairly promptly.
Sorry, a follow-up to that. Are we certain that we'll be able to get what we need to have to open up safely?
Certain is a very high bar. I feel confident that we will. Am I certain? I cannot guarantee anything.
Well, I'll have to dwell on that. Back to Mr. Cardwell, I believe. In regards to the filters, are they, the necessary filters for this issue with the COVID, are they going to be in place and working by the start of school?
So, Mr. Parker, we are first, before we put any filters in, with the information I shared with you, we have to see what is the limitations or maximum, I should say the maximum size filters that we could put into our system, because our school and many other schools aren't designed to take MERV 8, 9, 10, 11, 12, 13 filters. So we are doing a test on that now, and if room by room, building by building will be adjustment on a size filter, and we should have the capability of getting those filters in a timely fashion as we figure out which ones we are going to use in the building.
What is the timeline for that? Is that going to be in place by the start of, before we bring staff and students into the buildings?
My goal would be to have those filters within the next 3 weeks.
I'm going to have to dwell on that. I'm not feeling very confident in what I'm hearing that that'll be in place in time. My last question for now, college, heard about a college in New York that was testing their students actually twice weekly. Have we, Dr. Shirk, in your meetings, have we heard of, I couldn't find any other information on that. Is there anything out there yet that public schools, not just in Pennsylvania, but anywhere are able to make use of in, in an appropriate way with our age students?
Yeah, Mr. Parker, I had an opportunity today to meet with Montgomery County superintendents along with Val Arkush, our commissioner, who's in charge of Montgomery County Department of Health. And right now, they're looking at having rapid testing available for the county at the end of August. And that is pretty much, all she could guarantee. She's not guaranteeing any particular piece other than there's going to be 6 testing sites throughout the county that'll be back up and running. There was some difficulty with those sites, and those sites would do approximately 600 tests a day. So that particular piece is one that really we're not counting on, in this process. In fact, all Montgomery County superintendents really never counted on it, because the promises were made early on in this pandemic for us was 750,000 tests by September, and obviously we're looking at 600 a day. It's a little bit different, and the county has struggled to get the support they need during this process. So to answer that question, there is not testing available. We're not in a position like the schools in Montgomery County, schools across the country aren't in a position to do mass testing. No one is doing those pieces. And we're going to have to rely on our community to really self-assess themselves and really step up. And that's pretty much where we are regarding testing in the county. If that would change, obviously I would report that back to the board and the community. But right now, that is something that the county is working on. They do feel, though, on a positive note, that their contact tracing teams are up and running. They're going to double some size to 26 to 52 in the next 2 weeks. So they do feel that they can support us, in our schools if somebody does test positive, and then we can help, prevent the spread even further.
Bill, you done? All right,
Yes.
Dr. Shirk, if you could just simply walk us through maybe the beginning of school, as into the different stops are going to be, as in for parent drop-off, the school buses, how they're going to progress into the building, and then how are the kids going to get to their classrooms and such, and what's that's actually going to look like when they change classrooms and all. If you can give us just a picture of that, how that's going to look. You're muted.
Thank you. I'm sorry. Too many Zoom meetings. Bus drop-offs will be scattered throughout the buildings, the footprint, to reduce the number of students going into one door. We will have staff at the doors making sure that students have masks on when they arrive, and we'll be working to make sure students are appropriately socially distanced. We are considering using larger rooms such as gymnasiums, auditoriums, and our auxiliary gym to help break the students into smaller groups that can be spread out during that process. Each bus and the buildings will be supplied masks if students do forget their mask. And if a student refuses to wear a mask on a bus, we were not going to leave them at the bus stop. We were going to take them to school, and they will then, the principal, that building administrator, will be notified. The students also, when they come into our buildings, if anybody has demonstrated a raised temperature based on our thermal cameras, we will immediately be sent to the nurse's office. We're in the process, actually, and I think as I talk to you, we've had this discussion we started these discussions this week, and it's not, don't feel like, oh my, we haven't had that discussion. It's just, we have to really prioritize our discussions and step-by-step structures as we go through this. But the temperature would be, that student who we thought through the thermal cameras would have a raised temperature would then be escorted to the nurse's office for temperature verification and symptom screening. If a student at that time would demonstrate any COVID-19 symptoms, they would be taken to an isolation room, and the parents would then be notified to pick them up. Some of our hallways and pieces, obviously it's going to vary building by building, but hallways will be set up as a one-way hallways as much as possible. In addition, stairwells will be marked for one-way traffic. 2 stairwells will be up and 1 will be down. Signage will be all around, directing students and reminding students of the direction in which they need to travel. And we're looking at one-way traffic that will help limit cross traffic for spreading out in the hallways. One of the things that in our classrooms we'll be looking at is students will follow the aisles between the desks. So even within the classroom, there'll be a set roadmap, if you will, to help create the best physical distancing that we can. All students and staff will be required to use hand sanitizers in our hallways before entering their classroom, as well as exiting the classroom. We are going to wipe down our desk, and will be a community approach in which the staff will assist with that process. Now, with that being said, I talk about a community approach. I talked about it a little bit earlier tonight, that it's important that we all take the responsibility as we go through this process. One of the things that Commissioner Arkuch said is this virus is not going to go away. It's going to be with us for a long time, and we have to learn these pieces, and we have to learn it as a community and take that specific responsibility. Also noted that during the day, Mr. Cardwell and his staff, we feel that he will be able to get into the buildings, into the classrooms at least once, maybe twice a day, to completely wipe everything down and sanitize the room and disinfect the room as well. But we're also, we're going to encourage our students, part of our school-wide positive behavior plans, to wash their hands regularly, use the hand sanitizing stations, and bring their own hand sanitizer if needed, and that would not be a particular issue. Mr. Leach, does that answer your questions, or do you have any more?
That one did. I just have one more question. In regards to, we've discussed earlier about the Western Center possibly going more than just the 2 days and the virtual part. Is that still in the plan first?
Okay, yes, I can answer that. The Western Center at this time has the capability, has the physical space to run the program 4 days a week. They would use Wednesday as a asynchronous day. They would use it to have the office hours for their teachers, if they will. So they're looking at running their program Monday, Tuesday, Thursday, Friday, and whether or not we would be in the hybrid world or the virtual world, whatever that student's choice would be, or whatever our district's choice will be, the Western Center students would have that ability to be transported down in the morning, and then transported back. And of course, the afternoon group would have the same piece as well. And our upperclassmen, I know Mr. Maritzen is looking at allowing them to drive, which is something a little bit new down there, but we're looking at getting those kids down there because we understand that the hands-on component of that learning process at the career technical is very important. But the key there, and not so much obviously with our building footprints, is we have to cut our groups in half. We don't have the physical plant to do that, So, but he does. They have the square footage in their classrooms and in the labs to execute that education.
All right, so just to clarify, make sure I'm correct. They're going to be there 4 days. Obviously, our students are going to be here possibly 2 days virtual. And they will be able, those students that do not have vehicles or are of the age of driving as of yet, will be bused all 4 days.
Correct.
Perfect.
Like they normally would be. So if you're an AM Tech student, you would be bused down there. And again, it depends, because if we're virtual, then you know our buses wouldn't run. Dave, Mr. Nestor, you correct me if I'm wrong. They would not run, but the tech school would be in front of our high school, ready to pull out at 7:30 or whatever it would pull out normally. It would then come back, and then our PM kids would then leave and go back, and then we come back at 10:30 and then back at 2:30, just like it would be in a regular school setting.
If we're completely closed, but the Western Center is open, we'll have to discuss that. But I would think that we would probably want to transport the Western Center students from their home to the Western Center and back. But we'll have to have more conversation on that. If they're open for face-to-face instruction and we're closed, that may be a different solution.
Thank you for weighing in on that, Mr. Nestor.
Thank you.
Okay, I have a question. Can everybody hear me? I have a question. Dr.
Yes,
Short, do we have protocol for our staff entering the buildings?
I guess a little more specific protocols. We would have the same protocol self-assessment that we would ask our students to have before they come in. Our staff would walk through a thermal scanner as well. Those self-assessment pieces would be the same. We have talked about a self-assessment checklist, like a formal type of checklist as our students and staff come in. I know some of those pieces are being done with our voluntary workouts, but that's something that we would have a little bit more clear picture on. But the self-assessment piece is part of what we're asking our students and staff to do. And I'll stop there for a second, and I'll just go back to Mr. Boris. I don't know any pieces like that along the way, because regarding our safety plan, if there's anything to add or subtract there for what I said, I'd appreciate that.
Yeah, the only addition I might make is that will have that weekly questionnaire, which also monitors any changes in individuals' potential exposure to the virus or travel to an area that might have higher exposure.
Thank you. Thank you, Mr. Boris.
I did have some questions as well. I'm not sure if Patty was done or not. So if a student leaves school because they believe that they have COVID or their symptoms, and then a day or two later or a week later, it turns out that while they've been on self-quarantine, they tested positive. Do we decide who else goes on quarantine, or does the county, state come in and say, these are the people based on seating charts that should go in quarantine? Because I realize that we're going to have students 6 feet apart without a mask, but we're also believing that students are going to be sitting dead center on their desk, and there's not going to be kids like leaning over to talk to each other and for the 50 minutes that they're in a class. So just who decides who goes in quarantine?
I'll start that off, and then I'll just going to go back to Mr. Boris. I know those pieces are in our plan. The county, again today, let me just grab my notes here. They again emphasize their support for the schools when they believe they have a possible COVID case. So at that particular time, we are then in partnership with the county, with you know, the seating charts, from the seating charts to some of the questions I think was on our slide earlier about 6 feet, 15 minutes. They will then take over and make those specific decisions on who needs to be out, who needs to be contacted, and who can stay in school. And Mr. Voris, if there's anything else you'd like to add for Mr. Lappy, feel free.
Sure. And this is Mr. Lappick specified, I believe, on pages 36 to 37 of our plan. But specific guidance that we got directly from the Montgomery County Department of Health really further specifies what that partnership will look like. So in the event we have anybody who tests positive, the individual leaves and goes immediately to an isolation area and then immediately home or to a healthcare facility. We in turn are notifying our human resources department just to get staffing considerations up to speed. And then a couple of things you'll hear me say throughout this process is you'll hear me say, notify the Montgomery County Department of Health. Again, speaking to the partnership that Dr. Shirk was speaking to and their support. So we would be notifying them. That process would initiate contact tracing, and that would be looking at specifically who was with the individual while in school, who was the individual in contact with either in transportation, on the bus, who are other family members, live-in members, siblings that live with the child in the household or staff member in the household, and then determine all areas that individual was within our building. I believe Mr. Cardwell already spoke about any areas, once that confirmed case has occurred, that place, I won't even call it a classroom because it could be any number of places, that place is shut down for 24 hours, and that's really for a number of things to occur. After those 24 hours, the cleaning, sanitizing, and disinfecting can occur. Then again, we come to seek and rely on guidance from the Montgomery County Department of Health, meaning they give us information after we've gone through, provided them all that information, seating charts, exactly what that individual, who they came in contact with and when. We get additional guidance from them on how to proceed. Then we are communicating with individuals and families identified during the contact tracing process. And I say we, meaning it could be the Montgomery County Department of Health or the Pottsgrove School District. And then they end by saying, follow any other directions or protocols that you might receive from the Montgomery County Department of Health.
Okay, thank you very much to both of you for that. I do have a question, Dr. Shirk, just curious to hear your thoughts. We're offering, we're voting on whether a hybrid, virtual, what have you, whatever combination that is. But it seems like as we go through all this, every district around us seems to be switching over to a virtual only. Even Exeter this evening, about an hour ago, decided that even though they were going to go with 5 days a week in person and students in class, they opted to, go virtual. Just curious to hear your thoughts about that.
Well, I've had an opportunity to be thinking about this really since March, and specifically the virtual plan that we came out of, and then specifically the hybrid plan that we worked ourselves through over the last 6 weeks, and I think that really as a district we positioned ourselves as good as anybody in Montgomery County to give our community options. The hybrid plan is not a perfect plan. The virtual plan is not a perfect plan, and I say that because there's a learning process that's going to take place, and there's going to be pieces that aren't going to be as synchronous as everybody would like them to be. But it does give us an opportunity to present our community with choice. When you look at the survey, when you think about it, we're pretty close. I mean, we're pretty close to being split. When you look at the overall numbers, the middle school numbers are more in favor of virtual than the hybrid. But I think one of the things that we as a community have to understand is what's the risk we want to take. And I say this to the community tonight, but I've also said this to the board for the last 2 months. The virtual option is little or no risk. The hybrid option has risk. It's reduced risk. So we have to be able to look those pieces and look at all the pieces, look at all the information that we've shared with you all for the last month, and feel comfortable with our decision moving forward. If I, a lot of things, this decision is a community decision. This decision is a board decision. I feel that the administration has put a lot of good information forward. You're asking me what I would do. Tough, probably I'd say unfair question, but I do feel that we've positioned ourselves for both worlds, Mr. Lappick. And the hybrid world will be one where we're going to have to logistically take into consideration staffing, because some of our staff members who have severe health risks won't be able to join us in the hybrid world. So we have to make that adjustment. And obviously the virtual world pieces, we're going to have to make sure that we live up to the expectations where we're synchronous learning 4 days a week, and making sure that we meet all those expectations. So I think we've positioned ourselves to be in both worlds. And at this point in time, I feel that it's a community piece that really, I think we have to do what our gut says, what we feel comfortable with. And for me, it can be in either world, because we did our due diligence with our health and safety plan. And the virtual world, we positioned ourselves to make an improvements. So that's how I see it. And I know some of the factors, and honestly, with the 285 people that are still with us, there's a lot of unknowns and fear factors out there, and that's what we, as a district administration and board, have to come into play tonight. What we're willing to do. I'm willing to support, I'm willing to support the board. We're ready to go in either direction, and I think based on our information, the community is ready to go in either direction as well.
All right, thank you very much. And then I do have one other general question. It's been explained to us that with the teachers were surveyed, and with health concerns, there are going to be insufficient teachers in certain grades to support a hybrid learning venue. There's going to be the concern is that there will not be sufficient teachers in certain grades, and an entire school in one case, to give a quality education as a hybrid. And then it was brought up that we're not only going to have that issue, but then substitute teachers. We've been told that there's substitute teachers that have opted to retire this year instead of go back into the pool. So we're already at a deficit with teachers. So, I mean, my concern is that if we do a hybrid, is it going to be, like you said, it's not going to be the best if we do one, or it's not going to be the best if we do virtual. There is no winning. We're damned if we do, we damned if we don't. But it seems to me like it's sounding that if we go with a hybrid, the quality of the education may not be as good as the quality if we go with virtual, because we are going to have certain teachers that aren't going to be able to be in the school buildings, and we won't have the backup of substitutes for that.
That is a very true possibility. Yes, correct. But we will not know that until we go down that road. But based on our preliminary numbers, and I'll let Dr. Harney weigh in there in a second. Based on our preliminary numbers, that is something that we have to work through once all our staff weighs in on the healthcare side. Dr. Harney?
Yes, I just, and I've shared this information with Dr. Shirk, obviously, and the board. We do have a great many concerns about staffing the hybrid model in 3 out of our 5 buildings, as well as special education and also student teachers. And that's knowing the information that we have today. That list could grow once a decision is made one way or the other. So the concerns that I share and I've been sharing with Dr. Shirk and the board are substantial as far as how we can staff the hybrid model with the plan that we have put forward right now. So yes, that is factual.
All right, thank you very much, all of you.
Mr. Lindgren, if there's not any more questions, I have a comment before the vote if this is an appropriate time.
Yes, it's absolutely appropriate. Go ahead.
Thank you. I actually wrote this out, which I don't typically do, and I wrote it out before the board meeting, and I had to quickly go back and rewrite it. So I've given a lot of thought to this decision, and I've tried to listen to all the views and have weighed the pros and cons of each. In fact, I've been on the fence about my decision, as I said, until just a few minutes ago. Due to my belief that there are students that really need to be able to have hands-on, face-to-face instruction, I was ready to vote to allow hybrid instruction, to give the parents the choice. As my questions and concerns about safety have not been answered to my satisfaction, and that's not to put down any administrator whatsoever, that is not the point, I will not be voting for hybrid instruction to be an option at this time during the first quarter. I will, however, be willing to relook at this for the start of the second quarter. Now, let me say too, in case the board votes for hybrid to be an option, I strongly want to encourage the parents that are listening to only send your children to school if they have a clear need for that hands-on face-to-face instruction. I would also like to ask that parents only put their children on the bus that have absolutely no other way to get to school due to spacing concerns on the buses. We as a society are unfortunately all affected by this pandemic in various ways and need to continue to work together to get through this. We need to be patient with the scientists and doctors that continue to learn how this virus spreads, how to treat it, and how to vaccinate against it. I encourage all of us to be respectful and empathetic of those with different opinions than of our own. Lastly, Mr. Lindgren, when it's time for a vote, I would ask if it's okay that we have a roll call vote, please.
Absolutely. Would anybody else like to provide any comments before we have our vote?
Yeah, I just want to jump in here real quick. You know, I don't think it's any secret that I will be not voting for the hybrid plan. I did state, 2 weeks ago that,
Yes.
that I was absolutely decided. So it didn't take any swaying from me. I just, gut feeling. So I do know how much work has gone into planning the hybrid plan. It's not that I don't approve of the plan itself and how it's planned. I just don't feel that putting our kids in schools is the safest for kids, parents, families, staff, all that stuff. So teachers, I think I mentioned teachers. So I just wanted to put that out there. It's multiple reasons why I will be voting against the hybrid plan, but the main reason is just for the health and safety of our students and staff and their families.
Very good.
Okay, Bob, it's Patty. I also would like to have a moment for my comment.
Please.
Thank you. I too will not be voting for the hybrid. I appreciate everybody's effort, all the hard work everybody has done. but I just feel the safety is number one. You only have one life, and you cannot get that back. And I do not want to start school for our students for the first quarter. Maybe if we did it and we looked at our numbers at the second quarter, second marking period. But for those reasons, safety always comes first. I will also be voting no.
Yes, sir.
Yeah, I'm going to join with the others. I have some direct experience because I still teach in a four-year institution. And I was given the choice to either go virtual or face-to-face. And okay, I have health concerns. I'm over 65. But I agree with Patty. We're not just gambling with our lives, we're gambling with the lives of our kids. And that's scary. I mean, okay, I've had a good run. And if my run ends, well, I've had a good run. But I have grandchildren. I have a grandchild who's 7 months old. I have first graders and second graders. They deserve their chance. And I understand that there's been an awful lot of effort going into the hybrid. And I also understand that what we do in Zoom is not like a face-to-face meeting. These meetings aren't comparable to what happens when we meet at the school board. And you know that, and I know that. But I think we have to face the reality of safety being more important than teaching effectiveness. And that we're going to have to pay a price for it. But I agree with the others. This is too risky with our most valuable assets, our kids. So that's where I come down.
That's fine. So let's see, who have we heard from? We haven't heard from Mr. Leach or from Tina.
I'll go, Tina. My vote would be for the hybrid model. Now, the hybrid model, the reason why my vote would be for the hybrid model is going to be because I am the individual that believes in giving the other individuals options. I am never going to be the person to tell a parent that, no, I'm going to make the decision for you as into what's best for you. I'm going to be siding on the option. I want to give options. If the teachers want to come in, they can come in to work. If the teachers want to stay home, they can stay home and do the virtual. If the parents want to send their kids in, they can send their kids in. If the parents want to stay home and do the virtual, they can stay home. I am always going to lean on the side of giving the parents and the employees the options of what they feel is in best interest for them. As long as the governor and the health departments and every department I think we have has made a decision to say that it is up to the individual to decide. They feel that the plan is safe if we follow the protocols, which we have. I think we spent a umpteen amount of time to make sure everything is as safe as possible. So I'm going to lean on giving the options to everybody else, right? On that being said, right, there is no way, shape, or form if we decide to go virtual, that virtual is going to change come November 4th. It's just not. The virus isn't going to go away in September. It's not going to go in October, November, December, January, February, March, April, May, June. It's just not going to go away until that there is a vaccine or a treatment that is widely available, which will not be widely available to our children come 3 months from now, 4 months from now, or even 7, 8, 9 months from now. The likelihood of the children actually receiving a vaccine is probably not till 2022. So if our options are we're not going to go and try to live with the virus as safe as possible and give the parents an option and the teachers an option, everybody an option, then we're pretty much saying we're going to stay closed until 2022, because I don't see how we're going to be able to provide a proper education virtually. And if we decide to close, not only are we going to have to furlough a large portion of our staff, because there's no way we're going to be keeping the lunchrooms, secretaries, we're going to keep the custodials, the bus drivers, we're going to keep nobody that has not an essential position like teaching. So pretty much probably 200, maybe anywhere from 100 to 200 people are going to get furloughed. And they're going to get furloughed not for just a couple of months. They're going to get furloughed for an entire year. All right. And that's something I just don't think I can live with. On top of that, you're also talking, if you go virtual and you're saying it is not safe to operate the building, okay, then you are also saying that it is not safe to do anything else. That's going to be including the Western Center. The Western Center, obviously, if we can't operate our buildings at 6 feet apart, well, they can't operate their buildings at 6 feet apart. So in essence, those students that need to go in and get certifications, you're keeping them from possibly getting certifications. Because, sorry, we ain't open that building. I mean, we're not going to have busing. We're not going to open the building. I don't know what's going to happen with those. If you can do it all virtual, fantastic. But I don't know how you do certain things that the Western Center does virtually. So my vote's going to be for the hybrid, and that's where I stand.
Very good. Tina?
So for me, it's all about the choice as well. And the choice isn't limited just to families, it's limited to the staff as well. And that is why I'll be voting for hybrid. Thanks.
Short and simple. Thank you very much. Okay, Mr. Parker, that's pretty close to your roll call vote. Just mine left. So I'm all about choice. Always have been. Many people here know that since I was on the board, I've been a strong proponent of school choice. I've been a proponent of vouchers. I've been a proponent of charter schools and cyber charter schools. I don't actually campaign for them. I don't, really support them in any other way than ideologically. Haven't sent my kids to charter schools or anything like that. And it's funny because as PSBA has always been against charter schools, and certainly very, very much against cyber charter schools, that they're not a very good option. They're a terrible option. They're terrible. It's a bad education, bad outcomes, and they show you all the studies about what bad outcomes there are in cyber charter schools, and they're terrible, terrible, terrible. Until now. Now they're great. I don't understand the sudden turnabout as to how come now that's a great option. And I have to disagree a little bit with the way that it was couched just a minute ago. Dr. Shirk said this is the safe option, the low risk option. It's low risk only in one sense. It's low risk option only in the sense that it's low risk for catching COVID-19. That is the only sense in which the virtual school is low risk. It's not low risk for mental health. It's not low risk for child abuse. It's not low risk for the financial health of the district. It's not low risk for the health, the economic health of the district. It's not low risk for the people that are going to have to be furloughed. It's not low risk for the education for our students. It's not low risk for the careers of the kids at the VOTEC. It's not low risk for the special education kids who are going to suffer in a virtual world, who are not going to get the benefit of it. It's not low risk for the kids that are going to suffer because virtual is not as good as a face-to-face option. It's not low risk for the parents who are single parents or two parents who work, who have no childcare option, who have to go to work, who don't have an option. It's very, very frustrating. To me that we're saying that one size fits all, that everything boils down to we are going to decide what's safe and what's not. We are going to tell everybody in our community that they have no choice, that we are going to say what's safe and what isn't. I don't have that godlike omniscience that makes that determination for other people. I don't have that. I let other people make their own decisions, and weigh the risks themselves. I think that we can do this. I think this district, and I think our administrators, and I think our staff, I think our teachers, I think our facilities folks, I think we can do this as a community. I believe that with all of my heart. I know we can do this. I know we can do this. And just because we have a grade that says this particular grade, all of us have these health concerns, fine. So that grade has health concerns. That grade can move to the virtual world, and we can take teachers from a next door grade. Elementary teachers are certified to teach elementary grades. So if all of that grade is going to go virtual, I can take some from the next grade below and move them up. And they can teach face-to-face. We can move teachers around. We can shuffle, we can adapt, we can improvise, we can overcome. We are not constrained. We are not constrained. We have some of the most educated people in this whole area. By God, we can put those educations to use and come up with innovative solutions to solve the problems. Are you telling me that all of these PhDs can't come up with solutions? I refuse to believe that. I know that we can. I was looking forward. I know right now we have a percentage of teachers who have said, we're not confident, we're not happy, we're concerned for our health. I get that. I expected the number to be 3 times the number we have in front of us right now. I expected it 3, maybe 4 times the number we have in front of us right now. I truly expected it to be that big. I knew it was going to be a challenge. And I still expected us to be able to do this. Because even with those challenges, even with those holes, even with those gaps, it would still be better than no choice. For 1,500 kids who now get no choice in their education. 3,300 kids get no choice in how they're educated because of the vote we're taking. I can't imagine. I can't imagine that decision. One of my favorite shows that they ever had on television was West Wing. One of the most inspiring things that was in that show was when the president, he talked about schools being cathedrals of learning. Cathedrals of learning. What an aspirational thought. Cathedrals of learning. But they're not cathedrals of learning if they're empty. They're only cathedrals of learning when there's people in them, when there's teachers leading students. I thought about it the other day. I thought about it just the other day because it's about choice. It's about coming up with the right answer. As most of you know, I tend to be somebody who's black and white. I believe there's a right answer. When I took geometry here at Pottsgrove, my teacher was Mr. Worley. And one of the things we spent many weeks on was proofs, geometric analytical proofs. And one of the things that you learned was there's about 50 or 100 different ways to prove just about anything. And one of the things I took a great amount of joy in was trying to find the most elegant way of doing one of these geometric proofs. Could I do it in 8 steps? Could I do it in 6 steps? Could I do it in 4 steps? What are the fewest number of steps I could do? And I would do it 3 and 4 and 5 times until I found the one that looked the most elegant to me. And I would come in the next day and there'd be 12 other kids and they would have 12 different answers. And they would all be right. They would all prove the same thing. 12 different answers and they were all right. They all proved the same thing. And I learned that there isn't just one answer. Even in math, there isn't just one answer. But they could all be right. That's when I learned about what choice is all about. You got to give people the opportunity to come up with their own answers for their own lives. I can't tell people what the right answer is. I can only give them choices and options. That's why my vote is for the hybrid plan. And I can't change my vote. So that's all I have to say about that.
Bob?
Ma'am?
Jim did not speak yet about this.
Very good.
Okay.
Jim?
Sorry, I guess I should take it off mute. Sorry, I had to move outside because the dogs were getting a little bit anxious. They wanted to start jumping around, making noise. Yeah, you're saying that we're taking choice away from everybody, and you know, that's true to a certain extent. That I would love to have hybrid and know that everyone is getting the exact choice that they want. But I've heard what some, during our executive sessions, I've heard what some people have said that felt that if some people do not toe the line, there would be retribution, is what they're implying. And I know that they have no way of doing that, so it's not going to happen. But the fact is that there were people that were pissed off and wanted to take away, even though they were going to allow people to have a choice, they were going to make sure that it was going to be their choice. And I don't agree with that. Okay, Bob, I know you have your own beliefs about all this. I would like to have people to have a choice, and I do not feel that we can do that safely. I mean, that is a choice too. I'm making a choice that I would like people to be safe.
Mm-hmm.
We are split when it comes to the community. We've got a lot of people that want to go back 5 days a week. We have a lot, which we physically don't have room to. The Weston Center has room, which is why they are able to do 5 days. We don't. We've got as many people that want to go all virtual. I've received hate mail from people wanting to go all virtual to people wanting to go 5 days a week. This has brought out the worst in people. I mean, it has made us all less than we should be. But I don't feel that we should be taking a chance with our kids. That's what it comes down to. I would love to give a choice, but I'm not going to do it at the chance of risking our students, our staff, our teachers. I'm not, you know, so I'm going to vote for the virtual. I know it's going to get people upset. I know no matter what we do, it will get people upset. But I have faith in our community that we will find a way to make this all work and come together. I'm hoping that we'll start out with virtual, and that will give administration more time to come up with plans to make it so that it is safer to have students in class. And I'm hoping it will give time for teachers to say, okay, these are things that I can do, have time to speak with administration to say, here are things that we would like to see in place to make us all feel safer and students to feel safer. Maybe by going with virtual for the first marking period or 30 days, we can achieve that. I don't believe, like Al said, that it's going to be until 2022 before we see vaccinations. I mean, there's too much, you know, the Clancy's, everyone knows who they are. They put out lots of good information for people. There's so many different vaccinations that governments are putting in hundreds of billions of dollars into. So no, I don't think it's going to be by November 4th or January 1st even. But I know that next year, at some point, we will have a vaccine in place. But prior to that, I know that we will make it work within our community. Today, Ashley had a tree get pulled up, sucked up out of the wind, and land in her driveway. Before she could really do much about it, neighbors, community came to her aid, started cutting up that tree and taking care of it so she didn't have to. And I think that's what's going to happen. Thank you, Ashley. I'm going to use you as an example here, but thank you. You know, and that's what I think is going to happen. It's not the best solution. There is no way this is the best solution, but it's the one that I personally feel is going to be safest for people. And like I said, yes, it's going to make people upset, but we will make it work. And in the end, I feel that we're going to be more of us alive. So my vote's going to be for going with virtual.
Okay, very good. All right. So the motion to pass the plan as presented fails. Does that mean, Mr. Davis, that we have to make another motion, or does that mean that we have to make another motion to pass a plan for?
We're going to have to take some kind of motion for a plan because Bill Shirk, correct me if I'm wrong, we have to submit something to the Commonwealth. So right now we don't have anything, but everybody comes to school full-time in September. And I'm not trying to be facetious. I know that neither side of this vote was for that. So I would suggest, so it's clear to the administration and their authority to submit a plan, that you have a vote now on whether you want an all virtual plan. Bill, do you agree with that? That's what you're going to need?
I do, but we're going to change the checkbox, but we're going to keep all the work we did on the hybrid side. And that is the same thing for the next piece, 5.3, the instructional template. We're not going to change the instructional template because it gives two options, a hybrid program and a virtual program. The board tonight is just going to check a different box, and that's going to be the virtual box for the school health and safety plan. But all the materials that went into that piece are going to stay intact, because as soon as we go back, as soon as we change to a hybrid model, we're going to be able to make an addendum and use all the material and all the work we've already done.
Well said. So again, I think that we both agree we need a motion to check the box, which is a box that's virtual, but the submission of the plan will show the ability to go hybrid when and if we decide to do that.
So question, I think you just answered. So we don't have to make a motion that has a specific timeline. I mean, I, for one, don't want to see this go all year. I want it for the minimum time possible, because like I said, I was ready to vote hybrid as soon as we have things in place.
I know a lot of boards have put timelines on, and frankly, I don't think there's a requirement for that. You'll change when you get to that place you're comfortable. Frankly, I don't mean to be disparaging, because it's not meant to be disparaging. I think some boards, after this kind of rigorous debate that has really taken place universally, felt they wanted to make a statement that way, but I don't think there's any legal requirement. Certainly, if you want to do that, you can, but I think that it'll be up to the next motion to change to hybrid or full-time education. Not full-time education, we're certainly doing that, but full-time attendance by all. We'll make that decision when you decide to make it.
Thank you.
All right, so 5.3?
Well, do we need to make a motion for 5.2 or no? Yeah. So I make a motion that 5.2 be corrected to state virtual instruction only. Dr. Shirk, is that wording suffice?
It does.
Second.
We have a motion and a second that 5.2 be changed to virtual only. All those, and does anybody have any questions on that? There being no questions, all those in favor signify by saying aye.
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 All those opposed say no.
No.
No. So you have 5-3. Very good. Now, go ahead.
Yes, thank you, Mr. Lindgren. The next one, the emergency instructional template 5.3. This template was put together again. It was another piece by the Pennsylvania Department of Education that we needed to complete. It has both instructional options on it, hybrid program as well as the virtual academy. My recommendation is we keep it, we keep that intact because the goal will be to transition back to the hybrid piece. So that will be something that we'll need to have and do. So I would take 5.3 and make the recommendation to approve that as submitted.
So moved.
Second.
Does anybody have any questions on 5.3?
Yeah, the only question is I'm trying to figure out why we're voting for this. I mean, if it's virtual only, we're not coming back unless everything's been resolved to everybody's satisfaction and it's going to be safe. So I'm confused at all why we're voting yes or no on this.
Mr. Leach, we have to put together for the state the instructional options that we plan to use. I'm sorry, I don't know if you can hear me or not. Can you hear me, Mr. Leach? So
I got you. Patty's just
okay. So we have to put this together, and I would not want to put it in as a single option at this point, because I would think that as we progress in this process and get more data and just get a better feel for our community and the county, then I would hope that the next steps for us, which would be the hybrid program. So it's our plan for what we would do, and I would hate to X out the hybrid program and have to go back and put this in. And I'll defer Mr. Davis. I'm not sure. Would you agree with that or not?
I agree. Again, it's as I suggested earlier on the 5.1, it's more procedural than substantive.
But we do need both pieces to turn into the Department of Education.
I lost track. Was there a motion of 5.3, Mr. Lindgren, or are we in the question phase?
Yes, there was a motion and a second.
All those in favor signify by saying aye.
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 All those opposed say no. Ayes have it. Very good. All right.
Mr. Lingman, one housekeeping piece that I would just like to talk about would be the length of time in the virtual education plan. So my recommendation, I would probably, I can come up with a date tonight for the board, but I would prefer to give that more thought and have that ready to go for next Tuesday,
That's
if
fine.
that be permissible.
Yes, that's fine. All right, so Ashley, you want to help us through and see if there's any public comments for us?
Yeah, right now we have 2 hands raised.
All righty.
So I will start with Mindy Kern. I'm going to unmute you, and you'll have 3 minutes. Go ahead.
Can you hear me?
Yes.
Okay, good. I want to say thank you to everyone on the board. I appreciate the opinions of everyone. I know that even thinking about these decisions was hard enough for parents. You know, I know that like my husband and I'm sure every other parent has been more than stressed out about this over their own children. And I'm sure that this weighed even more heavily on board members. And as some of the members said, the most important things here are the lives of our children, and they're at risk. Yes, everyone should have the opportunity to choose. I agree with that 100%. However, you also have to remember that we have teachers, we have paraprofessionals, and they need the opportunity to choose as well. Some teachers that we have in the district are not able, unfortunately, to stand up for themselves for fear of losing their jobs or retribution by the administration, which is a shame to say. So now you have teachers, you know, board members that voted for the hybrid option. You know, clearly we have teachers that have said they don't want to come back because, you know, they're concerned. And you know, someone mentioned, maybe it was Mr. Lindgren, that, you know, you were surprised that not many teachers said they would come back. I think it's just because they're scared. They're scared of losing their position. So, and already not having enough teachers to cover 3 schools is already an issue. So I'm glad that the board voted this way. I mean, is this ideal for parents? Of course not. Is it going to be a hardship? Hell yes, it is going to be a hardship. You know, for families lucky enough like myself, you know, we are going to be able to adjust our schedules and we are going to be able to make this work. It's still going to be hard for us. It's not the start of the year that we wanted. But could we start off the year like Indiana just did? And, you know, could we have our kids sent home the first day? Absolutely. We could have them sent home in a week or 2 weeks or 3 weeks. And then we would have sent our kids back to school just to have them reset everything again and be home again. But we can be a shining example of a district who looked out for our kids and we lost none. Think about it that way. We can be the example. We can show the rest of Pennsylvania, look, we decided to keep our kids home for their safety. We didn't have to worry about an outbreak. We didn't have to be one of those schools that had kids sick. We all knew something like this was going to happen and the kids were going to be sent home anyway. So why not keep our children as absolutely safe as possible? So again, I applaud all of you. I appreciate you taking the time and effort. Again, I know this is so hard and I feel for the parents that have these other hard decisions to still make. I wish I could help them all out myself. But, thank you. Thank you very much for caring for these kids.
Thank you, Mindy. Can you just state your address, please? I forgot to ask.
I'm sorry, I did not
That's
do
all
that.
right.
It's 1286 Whitespire Circle.
Thank you very much, Mindy.
Thanks.
All right, next is Sarah Becker-Freilich. I'm going to unmute you and please state your address and then you'll have 3 minutes.
Can you hear me?
Yep.
Okay, my name is Sarah Becker Freilich. My address is 200 Fairview Street in Pottstown in West Pottsgrove. And I would also kind of like to echo the comments of the previous speaker and to thank the board and the administration for everything that they have put into preparing each of the different phases. As a school teacher myself, I recognize the difficulty and the near impossibility that that you have been faced with. I would like to thank the board for taking the courage to go against the grain tonight, to go against what was perceived as the right choice, and to take the courage to stand up and do the right thing for the students in your school district. None of you want to see in that high school yearbook a page dedicated to any students that were lost this year or any teachers that were lost this year. And I think that you made the right choice today. I recognize that it's temporary and that the goal is to move forward to traditional open school. And I appreciate that as well. But I just want to thank you for keeping in mind your students and your teachers and all of the staff and making the right choice. Thank you.
Thank you, Tina. Okay, next we have Tina Capiello. Tina, if you can state your address, I will unmute you and you'll have 3 minutes. Wait a second. There we go.
1282 White Spire Circle. I just want to thank everyone. I am a paraprofessional in the district, and I know this was difficult. I have a very hard time because a lot of my students that I work with who are special needs need to be back in school, but I feel the unsafety of what is going on in the world right now is more important, and I don't want to risk myself, my family, or any other student. I want to thank the school board for listening to everyone and listening to everyone's comments and questions. The school board and the administration has been wonderful, but it comes down to we need to think of our children. So in saying that, I want to thank all of you. This may affect my job. It may not. I do not know. But I appreciate all the time and effort that is going into the planning of all of this. Thank you very much.
Thank you, Tina. Okay, next we have Nolan Lewis. Nolan, I will unmute you, and if you state your address, you'll then have 3 minutes.
It's 11.
Oops. Sorry about that. Hold on. There. Okay.
Yep.
Go.
Okay. 1137 Brook Road. First, there will be people and students put at risk by just staying virtual. And, you know, it's not just everybody stays at home and shuts their door and they're safe. The people that work have to send their children to daycare who are then exposed. So you're not making it safe for everybody. And virtual is not a choice for everybody. Secondly, I don't understand the process of this and the board's role in determining whether the school should open or not based on their own feelings. If the guidelines say that it's safe enough to open and the school is working to meet those guidelines or exceed those guidelines, then the school should be obligated to open. There should be no debate in whether or not that's even an option. This should not be influenced by teachers as teachers. It should be influenced only by parents and families and teachers as parents. it just doesn't make, like, where is the end of this? What is going to happen that is going to make the board vote to open hybrid or full? There's no, basically you had a guideline and you just disregarded it, and you're just going on, of course it's safer to everybody stay home. And it's not for everybody, but you're making that choice for everybody. And it shouldn't be the school board's choice to shut the school down because it's safer. This is a public school. I don't understand. So the families and parents that are upset about this, please reach out to whoever, the board members that are voting against this and completely just disregarding everything. And just because it's safer, then stand up and get these people out of here. This is ridiculous. That's it.
Okay, thank you, Mr. Lewis. Next, we have Mark Stahl. I will unmute you and please state your address and you'll have 3 minutes. Is it, I'm still trying to unmute you. My apologies. There we go.
Yes. My name's Mark Stahl. I'm at 1489 Meadowview Drive. I just want to make, now that we have decided upon the virtual education, I just want to make sure that we're enhancing it as much as possible. School provides more than just education to students. I think that the certain needs need to be taken into consideration. For example, the child's well-being, where we evaluate the child, make sure that their home life is as efficient or as up to date as possible. And my, what I'm, I guess, encouraging is that the virtual plan, now that this is the direction that we're going, we need to add additional layers, for these children that potentially have, security issues at home, and take that into consideration. I think whatever plan we end up adopting, I definitely want to make sure that we're taking into consideration these children who maybe don't have the best home life, that we need to make sure that we're checking up on them to make sure that they're getting the best opportunity as possible, opportunities as possible. And I just want to encourage, now that we've adopted this virtual plan, if that's what we end up doing, that we make it as efficient as possible and we have the safeties in place that we would have in our normal learning environment. And also want to encourage, if there's anything that I can assist with, certainly reach out to me, my wife. We have education in this, and we'd be willing to, give advice or, provide whatever help we can in this area. And that's all I have. Thank you.
Ashley, you're muted.
Okay, my apologies. All right, thank you, Mr. Stahl. Stacy, I'm going to unmute you and you'll have 3 minutes and state your address, please. Thank you.
My address is the same as it was earlier, 1979 Summit Way. I first want to say again that the decisions were not easy, and I appreciate everything you've all considered. I do, however, strongly agree with Nolan's point about this decision supposing to be data-driven, based on data that you all have been collecting over weeks' time, as well as the data that you collected from the community over the last, 3 weeks, with the extension of from last week to this week. And I don't understand why none of that was considered when the decisions were presented as your own personal feelings and your own personal choices. If those people that have a concern about going to school have those concerns, then they have the option of virtual. Those of us that feel that the plan that the Pottsgrove School District has spent money and time in putting together is a reasonable risk and safe based on the guidelines presented, we no longer have a choice. And I also don't understand why, if we were going through all of this, collecting the community information, putting together plans, revising plans, adding thermal cameras, investing in everything we've invested in and doing all of these things, how board members can get in front of the public like this and say they've made their mind up 3 weeks ago. That implies no new learning is going on, no new consideration for data and procedures and policies have been considered. And we might as well have closed this decision 3 weeks ago and let all of us parents get on with making our plans. So I'm extremely disappointed at how the final decision was decided upon. There is no way that you should have had your minds made up 3 weeks ago and have it be fair to hearing all of what we all had to say and present, and everything that Dr. Shirk has presented as far as what's being put into place with the filters and the cameras and everything else. So while I respect your decision, because I'm not there making it, I do not agree with how it was decided. It's unfortunate.
Myself. All right, thank you, Stacy. Next we have Lisa.
How was that?
Buchko again. Again, state your address and I will unmute you and you have 3 minutes.
Hear me?
Yes.
Okay. Lisa Buchko, 18 Creekside Drive. Basically, Stacy just was saying every point that I had wanted to make. So just to reiterate, I absolutely respect the decision that you made. And, you know, I think it was Mr. Lappick who said you've been getting death threats, hate mail, whatever you were getting. I'm sorry for that. Because that should never happen to any person. Should not be getting that type of treatment. You guys are in a no-win situation. One of the things, though, I kept hearing as a common theme for those of you who voted against the hybrid model was we're not giving people, people don't want to go back. There's some teachers that may not want to go back. It's not safe. This is all about a choice. And you've eliminated giving anybody a choice. Teachers, some teachers would want to go back. Some teachers would want to go virtual. You've eliminated that choice. Paraprofessionals, some would want to go back, some would want to stay virtual. You've eliminated that choice. Students, some want to go back, some want to be virtual. You eliminated that choice. Families, some want to get their kids back to school, some want to stay virtual. You eliminated everybody's choice. Nobody has a choice now. Nobody. You've eliminated jobs. You've eliminated choice. Why did we just spend, as Stacy said, 3 weeks agonizing over decisions, agonizing, contacting child care centers to try to find ways that these children who are going to be falling through the cracks can get some sort of support during the week? It's unbelievable that you have removed choice from families. Families who rely on free or reduced lunch, what is going to happen to them? What is going to happen to this $30,000 that you just spent on thermal imaging? You've given nobody a choice. For 6 months, I have had to sit with my employees who are essential workers and coach them through going back to work, coach them on PPE. Our employees never missed a beat. We worked the entire time, going into people's homes, going into businesses, going into nursing homes. And they did it. We did it. My company has not had one case of COVID-19. None. Knock wood, we don't have anymore. My point is, you've eliminated people's choice. And now for the past 3 weeks, people could have been taking that time to figure out how they're going to manage this decision when it should have been just made 3 weeks ago. If those who already voted against it were clearly not going to listen to any other facts or data or even take into account the survey that you asked us. Again, it's a no-win situation. I get that. Nobody's going to be happy with it. I just feel that choice, giving people a choice, would have been the best option, and then let people decide how best to handle their own situation. It's been made, we move forward. I hope we can pull together as a community and get through this like we did with the centers and all just band together. But this decision was not what the people who voted you in asked for. Thank you.
Mute. Thank you, Lisa. All right, our next hand raised is Keith Mowry. Keith, I will unmute you if you can give us your address. You'll have 3 minutes.
There we go. I'm at 142 Birdsong Way. I guess what I was a little bit late getting to the meeting tonight, but what I'm having a hard time understanding and accepting is that the school board administration puts together what they believe to be a safe plan. The majority of the community was for the hybrid plan as well. So we have two, the administration who has to make it happen, the community who is a part of the choice in the process, but yet we have 5 people who think they know better than the administration who brought it forward, than the community members who said this is what we want. I work for a company that never shut down, essential workers. We made sure that everybody had food in the grocery stores over the past 4 months. And it is scary going back and out in the real world, but as you do it, you realize you can do certain things to be safe. And when you're out working and doing things, it becomes less scary. So, so I think we could have done this safely. And I guess my biggest, concern is how we have 5 people who think they know better than what the administration brought forward as a plan and what the community wanted. It's very disappointing. Thank you.
Mute. Okay. Thank you, Keith. Next, we have Rick Rabinowitz. Rick, again, state your address and you'll have 3 minutes.
I actually didn't mean to raise my hand. I didn't even know it was raised.
Okay.
But since I have the floor, I know a lot of people are upset with you, and I just want to point out that no matter what you did, you were going to have a lot of people upset with you. And I know each of you struggled with your vote, and I know how hard it is to be sitting where you all are sitting, and much empathy to every one of you. And that's all I have to say.
Thank you, Rick. All right, next we have Stephanie Bricker. Stephanie, if you can state your address, and I will unmute you. You'll have 3 minutes. Try that again.
Am I unmuted now?
There you go. Now you can go. Sorry about that.
I'm Stephanie Bricker. I live at 2738 Press Hill Road. And I want to first say thank you to the board, to the administration for all of the hard work that I know you've put into creating your plans and trying to provide the best opportunity and safe opportunity for our students. I know the safety of our students is the top priority, and I really appreciate the fact that you did decide to vote for virtual to begin. And I know that's a hardship for parents, especially younger children, but I think from an educational standpoint, this is going to provide the teachers time to perfect and focus on the best way to deliver instruction and provide equity for all students, and to have the time to create. I know there was a comment made earlier about cyber schools, and I'm a public school teacher, so I am firmly in the camp of public education, and you can make a good public cyber learning opportunity because you're gonna reach the needs of all the students, you know, the ones with the 504s, with the GIEPs, and have that opportunity to plan and make contact with those students and with students with IEPs and who need special supports. That can now, you have the time to build that plan and to really, you know, emphasize all the needs of all the students. So thank you so much. I appreciate how hard this has been for everyone. And as a parent, I appreciate everything that you do. And thank you so much. And I think this will be the best use of the school district's time now that there's a point of focus and not trying to divide their attention between hybrid and virtual, and maintaining our students' schedules. So thank you very much. Have a good night. Thank you.
Thank you, Stephanie. All right, next we go to Daryl Tillman. Daryl, state your address and I will unmute you. You'll have 3 minutes. Maybe. There we go. There you go.
Daryl Tillman, 151 Rose Valley Road. I just want to say to Dr. Shirk and his team, thank you for all the effort you put in. I do wish and hope that you get a day or two to decompress before the school year begins, because if not, you're going to burn out. That's all I got to say.
Thank you, Daryl. Okay, next we have Wendy Palma. Wendy, I will unmute you if you can give your address, and then you'll have 3 minutes. In theory, I'll unmute you. Let's see if we can try this again. Come on, Zoom. Oh, I had it. There we go.
Hello?
We can hear you, but you're really garbled.
Can you hear me? Hello?
There you go. That sounds a little better.
This is Palma, 1485 Meadowview Drive. I'm a community member. I've got 3 kids in the district. I'm also a medical professional that worked firsthand with the COVID patients through the pandemic and continue to. I just want to first thank the administration. I think they had a really thoughtful and meaningful plan, and I know the hours that went into it were countless. And I really think we've got a great administration. I also want to thank the board members because, again, I think from day one when this started, the communication was transparent. There was always daily communication, and I think that's key. In my opinion, I think if there's any risk for loss of life, or even we don't know what the complications are down the line, you have to err on the side of caution, just in my personal opinion, what I've seen. So I just want to thank the board for taking life so seriously, because even if it's just one life, that's one life. That it's really not worth that risk, in my opinion. So I want to thank you for all your hard work.
Thank you, Wendy. All right, next we have what's showing Stephanie Bricker, but am I incorrect? Did she just speak?
Did you hear me?
Yeah, put it on. I put it on screen.
I can't. Right. Let's see. Stephanie, are you?
I had already, I spoke and
That's what I
my
thought.
hand never lowered. So I'm
Right,
good.
okay, that's what I thought. Okay,
Thank you.
so, thanks. That's it. No more hands raised. Mr. Lindgren? You there?
Okay. Yeah, I'm
Okay.
here. Okay, well, that's the end of public comment, and we have no new business, and that brings us to item number 7.
Whoa, Bob,
We do.
we do have new business. We
I
should.
item
I know, but we should have new
correct
business.
me if I'm wrong.
There's things
Okay,
we're gonna have to discuss now.
it's a night for flexibility then. All right, let's make it item 7.1, which was on the agenda, if you recall, Laurie. 7.1, new business. Please.
So obviously, I'm going to have to go with the new business thing. Is obviously, since we voted for virtual, we're going to have to make some very hard decisions going forward. I think the board needs to give direction to the superintendent. 1, we need to cancel all sports. 2, we need to figure out what we're going to do with special education because they can't come into the field, into the things. Extracurriculars. Obviously, that can't happen. So we need to stop that, make sure that's all taken care of. We need to unfortunately tell the Western Center students they're not going to be able to go to the school either. Because if we're going this all by safety and not based off of anything else, there's no way we can pick or choose why it's not safe, or tell our parents and the community why it's not safe to go into the building and be a school for a hybrid, but it is safe at the special education. It is safe for sports. It is safe for Western Center. It's just obviously by majority. Just because I disagree doesn't matter. It's still the majority of the school board. We need to discuss on closing those items. We also need to discuss rather quickly, because it wouldn't be fair to those that we're going to furlough to wait until they're about to start. So we should be discussing that to the bus drivers, the custodials, the groundskeepers, every person that we're going to furlough, secretaries, assistant principals, dean of students. I mean, I don't know if we even need guidance counselors. I don't know. Obviously, Dr. Shirk will have to decide on what is an essential person to run the school virtually when there's no one in the building. And then obviously, I mean, you need to figure out how everything's going to go. Preferably, we probably want to do that quick. I feel really sorry. I mean, the majority of the community sent us notification that they wanted us to do hybrid. I always vote for the majority of the community because that's who I represent. Unfortunately, we're not going to do it that way. So we got a lot of hard decisions and really not a lot of time to make them.
The decision's been made. It was all wrapped up. We did talk about this. This was what the discussions were that we had. We had these discussions, and the decisions have been made. The die was cast. So it's just basically making the motions and going through with them. So you're right. All of those things that you said are true. The thing is, in terms of the free and reduced lunch and the meals, the only thing really to be discussed there is last year, as part of the program, as part of the federal bailout, as far as the federal emergency funds, they were able to expand the program to include, basically they were able to give money, and we were able to expand the program beyond what it normally entails, which in our case only covers West Pottsgrove. So for us right now, we could only service West Pottsgrove as it is, unless Congress does something and the program is extended again this year, but we have nothing. We can't act on a supposition that they're going to do that again. So if we're going to, we can't really make a plan one way or the other on that. But we can move forward, you know, on the bus drivers. We can move forward on athletics. We can move forward on the other things. And it's just a question of how far and how much we're going to do. But you're right. I think we do have to move forward with a lot of those things. I don't know that we need to do it tonight. Certainly, we can wait probably till next. We could do it tonight, but we could probably wait until Tuesday of next week for our regular board meeting and take care of it all then. Unless people want to do it tonight. If you want to make a motion, we could do it, but I think it would be a little bit more orderly, take us time to write down all the things and put it in order and take care of it all by next Tuesday. Would you agree to that? Or do you want to do it tonight?
I would prefer we wait until Tuesday so we have all our I's dotted, T's crossed on exactly how we're going to handle everything. But unless others on the board feel that we should just make the motions tonight, that's up to the whole.
I strongly recommend you not make any motion in that regard tonight until, as you both indicated, that we have properly thought things through and we have proper motions and understand the ramifications we're doing and avoid any unintended consequence.
Thank you. That's sage advice. Thank you very much, sir.
Mr. Lingren?
Yes.
If I could just weigh in regarding the sports piece.
Please.
What I would recommend to the board is that this week the PAC ADs met on Monday. Tomorrow the PAC principals meet, and they're putting forward some recommendations for the league that would be out this week, either Wednesday afternoon or Thursday. I would like to postpone the start of conditioning, heat acclimation, if you will, for the football program until Monday the 17th. I just want to check Monday the 17th, and that's the day that all fall sports are allowed to begin. That way, it'll allow our league and our representatives to weigh in over the next few days, and that will help frame, that'll help frame it a little bit better for us as we move forward in the next week. So that would be my recommendation. I just wanted to get the rest of the board's thoughts on that, to be able to tell Mr. Ansbach, and let the football staff know that would be a postponement of that start date, pending further recommendations from the league and our board.
Normally, you've known my practice. Never since I've been president of the board have I ever made a motion, but in this case, I'm going to make a motion that we delay all sports, all activities until the 17th. Would anybody care to second that motion?
I'll second it.
Thank you very much. Does anybody have any questions on that motion?
So this is putting sports off by 1 week, Dr. Shirk?
That is correct, and we'll have more information from our league representatives, ADs, and principals either Wednesday afternoon or Thursday morning.
Okay.
Tuesday, the 4th, it would put it off for 13 days.
Dr. Shirk, would this also include band then?
All activities, yes.
Okay.
Can I just ask a question? I don't know if the superintendents got together about this piece, but with athletics, something I had thought of, and I'm definitely not alone in it, was if PIAA could step outside the box and consider moving some spring sports to fall. There are sports that can be done easily. We know that. Golf, bowling, baseball, softball, things like that would require stepping outside the box. I sent an email to PIAA. I didn't hear back. I didn't know if there was a consortium of superintendents who could or would come together to see if they might put something in place like that so that the kids don't have no sports.
Yeah, I know that similar thing has been done with football.
yes, Mrs. McIntyre, we have, the superintendents of Montgomery County have poked and prodded PIAA for the last 2 months, and pretty much received the same results as you have, and that's no comment. So I know that some surrounding states are pushing sports to fall sports to spring, etc. So I think our first step, and I appreciate your enthusiasm, your willingness to have those options. Let's look for the recommendations of our league, and Dr. Ziegler, our high school principal, is the president of the PAC, and he and I have spoken to these points, and we'll look for some direction from him and the other principals of the league, and let's see what those pieces would formulate moving forward. But those are options that we would that I would continually support, as we work forward. But unfortunately, the PIAA has not stepped to the plate for school districts in the state of Pennsylvania.
What I get nervous when we say all sports, all activities. So what, clearly football is a contact sport. So what other activities and sports does this affect that's not a non-contact sport and activity?
Are you kidding me? I'm asking in all sincerity. Are you kidding?
Mr. Lindgren, please stop. I think I asked a legitimate question.
All sports. It's not ambiguous.
All activities, all sports. I think I can ask a question on the motion, Mr. Lindgren. Dr. Shirk, what activities, what clubs are affected by this?
At this point in time, it would be our band. There's no clubs that have started yet because we haven't started the school year, so none of that has taken place. The fall sports season officially starts for everyone but football August 17th. So what this does, it just pushes the heat acclimation period 1 week so that the football team would be starting on the same date as everybody else would be. Golf, tennis, soccer, they all start on the same date, but because of the heat acclimation, they get to train, if you will, a week ahead. So we're just asking, what we're asking, and what Mr. Lindgren's motion was to just postpone that start till the 17th, let our league representatives weigh in, giving us more direction, and we'll go with that information that we get. We'll share with the board and and the public at this week, and then we'll have more conversation next Tuesday night.
And why postpone band? I'm not saying I disagree, but just for our understanding. You're muted.
I'm not going to speak for Mr. Lindgren, but I think he just kept it cohesive. Everybody's in the same playing field, and I don't know. I don't want to speak for Mr. Lindgren.
I'll jump in there on why no ban, because we just said it's not safe for our students to be in a building 6 feet apart being educated. Then it's not safe for football. It's not safe for band, marching band, any band. They're obviously not going to have masks on, which was a major proponent that was possibly a reason why we're not opening. Obviously, it's clear that the majority of the board feels it is not safe at the present time. And hey, that's fine and dandy. I'm all for it. I always support the final decision of the board. But if you're saying it's not safe, then it's not safe. It doesn't matter if it's band, doesn't matter if it's football, doesn't matter what it is. It's not safe, you're saying. I don't know what to say about that, but it's just not safe. Just
I think a couple of people are upset by the majority of the vote, board's vote, and that's unfortunate. we've spent a lot of time, a lot
Whoa,
of
whoa, 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 whoa,
looking
whoa,
into.
whoa, Bill,
I'm
Bill,
speaking.
Bill, Bill,
A lot
Bill,
of research.
Bill.
I'm
I
speaking.
can talk all I want, Bill.
I'm
I
speaking
am not
now.
upset about the board's vote. You can sit there and
Okay.
say I'm upset and you're going to say anything you want. Go right ahead.
Thank you, I will.
always support the full majority of the board on whatever the decision is, no matter whether I am on the one side or the other. But you
Right.
can't pick and choose.
Actually, we can, and that's
No,
our
you
job.
can't.
We took.
I'm sorry. I don't believe you can. That's my opinion. I don't believe you have the right to say, I'm going to pick and choose which I feel is okay and which is safe. I don't believe that.
Well, I disagree. So is there, I don't know if we have anybody from band here. I'm not a band parent. Is there concerns with, because I know we spent a lot of time with the health and safety plan. Is there concerns with space and so forth? My understanding, and I think summer band is just the marching band. So I'm presuming that's outside. Is there issues with safety that we need to look at? If so, then I'm in agreement. If not, if it's already been looked at, then I don't agree. Chuck, you were raising your hand.
I was a band parent. So 2 points. Number one, band can practice drill, which probably is going to keep you more than 6 feet away. I'm not going to pass judgment about what we do now because I think the motion that was proposed was all meant all, and I don't want to get involved in the parliamentary hassle there. But as a band parent, band is not a contact sport, which football happens to be. And so that's a distinction, whether it's a sufficient distinction to justify this in this case, I don't feel comfortable passing on this. You asked a question, is anybody here a band parent? I was for 5 years because 2 kids were in the band. But it's not a contact sport. Kids stay distant. That's the point of the drill. And you think of, if the band wants to practice, we should vote on it now. And I think the motion that's on the floor is in order and probably is okay, because we probably should defer it until we've had time to sort this stuff out.
Thank you, Chuck. I'm going to go with the recommendation of the superintendent to postpone football specifically. So thank you for the clarification.
Okay.
I can just jump in about band. I never was a band parent, but I do understand how much effort needs to be taken to especially play the brass instruments. The amount of air being forced through those instruments. And I mean, geez, they even have valves on it to get the spit out of the instrument. So when we're talking about aerosol transmission, and it's transmitted more efficiently when there's yelling, singing, all that. Well, I just see the especially the brass and the woodwinds being just prime spreaders right there.
Yeah,
and I know they're outside. I get it. I do, but I'm just thinking about that and just going. I wouldn't want to only be 3 feet away from someone playing their tuba.
I'm sorry, Dr. Shirk. I've let this go on too long. I know the motion was all, but the only thing that's being deferred a week is the football conditioning, which is non-contact, and it's just football. So all of this discussion was really unnecessary. I said all, but it's really only football and it's conditioning. So, I can change the motion, or we can just let it go through with all, and it really only applies to football conditioning, which is non-contact and doesn't include band. So you could just vote for my motion and let it go, or we can change it. What is the preference of the board?
I'm happy to vote for the motion.
Outstanding.
Same here.
Thank you. All those in favor signify by saying aye.
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 All those opposed say no. Sorry to put you all through that, but I kind of enjoyed it. All right. Any more new business? All right. 7.2 then, I guess, would be motion to adjourn.
So moved.
Second.
Okay, all those in favor signify by saying aye.
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 All those opposed. All right, thanks very much, everybody. Have a good evening.
Good night, everybody.
That was embarrassing for them, yeah.